For older adults, death may be near when this area itches. And what if I told you that that itch that won't let you sleep, that persistent itching you might attribute to dry skin or just getting older, could be a warning sign of something much more serious? It sounds unsettling, and it's important that we pay attention to it. I am Dr. Fernando Minocchi, a nephrologist, and I dedicate my life to the health of our elderly population. Today, I want to give you a warning that all doctors wish people knew. There is a silent danger that many ignore, a cry for help that your own body sends you. A simple itch, when it appears persistently in 3 very specific places, can be one of the first signs of a serious disease progressing without you realizing it. Today, I reveal the 3 places on the body where intense itching is a red flag that you should never, ever ignore, especially if you are already over 50 or 60 years old. Stay with me, because understanding this in time can be the difference between a long, healthy life and a diagnosis that comes too late. Throughout my years as a doctor, I have seen stories that could have had a very different ending. Patients who come to my office with almost irreversible kidney damage or with liver problems so advanced that treatment options are limited. And when we review their history, we often find a common symptom that was ignored for months, sometimes for years. An itch that wouldn't go away. Most of us think itching comes from something external, an insect bite, an allergy to a new cream, or friction from fabric. And yes, many times it is that simple. But we must understand that our skin is like a mirror of what's happening inside. It is a giant organ that can reflect the health of our deeper systems. When the organs that cleanse our body, such as the liver and kidneys, begin to fail, they don't always hurt. Sometimes, instead of obvious pain, they send subtle signals, and one of the most common is itching that has no logical cause on the surface of the skin. It's like the check engine light on your body's dashboard, and today you will learn to interpret it. Imagine this scene, because I have seen it many times. A person, let's call him Carlos, 65 years old, starts to feel terrible itching in his legs at night. It doesn't let him sleep. He scratches until he injures himself. His family says, "Dad, it's because of age. The skin gets dry. Put on this cream." Carlos tries one cream, then another and another. He spends money on lotions and remedies that do nothing for him. The itching is still there, maddening, constant. What Carlos and his family don't know is that this itch has nothing to do with dry skin. It is a cry for help from his kidneys, which are silently failing. They have stopped filtering toxins from the blood properly. This accumulation of waste and the mineral imbalance it causes, such as calcium and phosphorus, irritate nerve endings from the inside out. His body is not asking for a cream. It is crying out for treatment that could save his life. By the time he finally sees a doctor, alerted by another symptom such as swelling or extreme fatigue, the damage is already significant. This story repeats itself with liver diseases and even certain types of cancer. The problem is that we get used to treating the superficial symptom instead of asking ourselves, why is this happening? And when we talk about persistent itching in an older adult, ignoring the root cause is a very high risk. Early diagnosis is everything, and that itch could be your first and best opportunity to act. Main content: the 3 dangerous areas. Now let's get to what matters. Not every itch is an emergency, but if it appears intensely and persistently in these 3 areas, you need to pay maximum attention. Place 1, the palms of the hands and the soles of the feet. The first place that should raise suspicion is perhaps one of the strangest, the palms of the hands and the soles of the feet. If you feel intense, deep itching, almost as if it comes from within, and it gets much worse at night, that is a huge red flag. I'm talking about an itch that is not relieved by scratching because there is nothing on the surface. You can look at your hands and feet and see absolutely nothing. No rash, no welts, no dryness, but the sensation is unbearable. This type of itching, known as cholestatic pruritus, is a very important clinical clue that may point to a liver problem. What's happening here? Your liver is your body's treatment plant. It produces bile for digestion and uses it to eliminate waste. When the liver is diseased or its ducts are obstructed, that flow is interrupted. Certain substances that should be eliminated, such as bile salts, accumulate in the blood. Today, we know it is a complex process. where various compounds end up irritating the nerves in the skin. For reasons still being studied, this irritation is felt especially strongly in the palms and soles. Ignoring this signal can delay the diagnosis of an underlying liver disease until it reaches an advanced stage, such as cirrhosis or liver failure. If you feel this unexplained itching in your hands and feet, don't go to the pharmacy for another cream. Make an appointment with your doctor and request a blood test to see how your liver is functioning. If you find this information useful and eye-opening, I ask you a small favor that greatly helps this health message reach more people. Take a second to like this video and subscribe. That way you won't miss other warnings that could protect your health and that of your family. Let's continue. Place 2, the back, chest, and legs. Generalized itching. The second type of itching is not limited to one place, but its nature is unmistakable. I mean generalized itching that comes and goes and can affect your entire body, but is often felt more strongly in the back, chest, and legs. It's an itch that drives you crazy, that gives you no relief. This can be a warning sign of chronic kidney disease, as in Carlos's case. It is known as uremic pruritus. When the kidneys, our filters, begin to fail, urea and other waste products that normally leave in urine accumulate in the blood. As I explained, this accumulation and the imbalance of minerals in the body are one of the main causes of this systemic itching. It's an internal problem, not a skin problem. In very advanced and rare cases, you may even see a white powder on the skin known as uremic frost, which are urea crystals. The most dangerous thing about chronic kidney disease is that it is a silent killer. You can lose a significant portion of kidney function without clear symptoms until signs like this unbearable itching, fatigue, swelling, or cramps appear. By then, the damage may be severe. If you suffer from itching all over your body that does not improve with anything and feels deep, especially if you also have high blood pressure, diabetes, or family members with kidney problems, it is essential to consult a doctor. A simple blood and urine test can detect a kidney problem in time. Place 3, a specific area with a mole, spot, or lesion that does not heal. The third place is the most deceptive because it is small and localized. I'm talking about persistent itching in a single spot on your body. It may be a mole that suddenly starts to itch, a small rough spot that doesn't go away, or a little wound that never seems to heal and always itches. Many people dismiss it thinking it must have rubbed against something or it's just a pimple. But this localized itching can be one of the first signs of skin cancer, such as basal cell carcinoma or the most dangerous, melanoma. Why does it itch? Cancer cells, as they grow uncontrollably, can release substances that irritate the nerve fibers in the surrounding skin. Sometimes the itching appears even before changes in the lesion are very obvious. The famous ABCDE rule, asymmetry, irregular borders, varied color, large diameter, evolution, or change, is key to detecting melanoma, but I would add the P for pruritus, itching. Additionally, although less common, generalized itching without an apparent cause can also be a reaction of the body to an internal cancer, such as lymphoma. The rule here is simple. Any new skin lesion that itches, bleeds, changes shape, or does not heal within a few weeks should be evaluated by a dermatologist. And if a mole you already had starts to itch without reason, it is a sign to make a doctor's appointment without delay. Don't postpone it. I know what we just discussed is alarming. It's normal that right now you're thinking about every little itch you felt lately, mentally reviewing your skin. I understand perfectly. Hearing words like cancer, kidney failure, or liver failure is frightening, and it is a natural human reaction. But before panic sets in, I want you to take a deep breath, because the key is not to live in fear, but with knowledge. In a moment, I will give you the tools to differentiate a simple annoyance from a real warning sign. And most importantly, I will tell you the exact and simple steps you can take to take care of your health and have peace of mind. Most of the time, the solution is simpler than you think, but only if you know what to look for. Stay with me, because this final part is the most important. Solution and peace of mind. I know we have talked about serious issues, liver failure, kidney failure, and cancer. My intention is not for you to live in fear of every small itch, but to give you the power that knowledge provides. Let's quickly recap. Intense itching in the palms and soles, especially at night. Think about the liver. Generalized desperate itching in the torso and legs. Think about the kidneys. Itching in a single spot, on a mole, spot, or lesion. Think about skin cancer. Now let's take a deep breath. The vast majority of itching is due to benign causes. The most common, especially in older adults, is dry skin or xerosis. With age, the skin loses its ability to retain water. Other frequent causes are dermatitis, allergies, or stress. These usually improve with basic care. Practical tips. For common itching, the advice is simple. Drink enough water, use mild, fragrance-free soaps, and choose cotton clothing. And after showering while your skin is still damp, apply a good moisturizer. And please, avoid scratching with your nails, as it only damages the skin. Instead, press gently or apply cold compresses. But, and this is the most important message of the video, if your itching is different, if it lasts more than 2 weeks, if it is so intense that it prevents you from sleeping, if it does not improve with basic care, or, and this is key, if it is accompanied by other symptoms such as extreme fatigue, weight loss, fever, night sweats, or a yellowish color in the skin, do not hesitate for a second. Do not wait. Do not attribute it only to age. Consult your doctor. A simple blood test can be the difference between detecting a serious problem in time, when it is treatable, and facing a much more complicated situation that could have been prevented. Your body speaks to you. Learn to listen to it. Thank you for joining me. I am Dr. Fernando Manaki, and your well-being is my priority. See you in the next video.